Cardiovascular disease remains the leading cause of death worldwide, responsible for nearly 1/3 of all global deaths. In the United States, cardiovascular disease causes over 800,000 deaths per year, with nearly 1/4 being sudden cardiac deaths. Despite declining coronary heart disease mortality, rising obesity, type 2 diabetes mellitus, and metabolic syndrome threaten future progress. Cardiovascular disease may present acutely as myocardial infarction, arrhythmia, or sudden collapse, or chronically as heart failure or valvular disease. Risk factors often precede clinical events by years, making early recognition essential for prevention and long-term outcome improvement. Cardiac symptoms arise from ischemia causing chest pain, pump failure causing dyspnea, obstruction causing congestion, and arrhythmia causing syncope. Symptoms triggered by exertion strongly suggest cardiac pathology, while asymptomatic disease may still present with abnormal ECG or murmurs. Complete cardiac diagnosis integrates etiology, anatomy, physiology, and functional class using the NYHA system. Etiology includes ischemic, hypertensive, congenital, inflammatory, and cardiomyopathic causes of cardiovascular disease. Diagnostics begin with electrocardiogram evaluation for arrhythmias, myocardial infarction, and structural abnormalities. Imaging modalities include echocardiography, computed tomography, magnetic resonance imaging, and positron emission tomography. Laboratory tests such as lipid profile, C-reactive protein, and BNP support diagnosis and risk stratification. Invasive coronary angiography is reserved for cases where results will directly change management decisions. Family history is critical in inherited conditions such as hypertrophic cardiomyopathy, Marfan syndrome, and long QT syndrome. Functional impairment is assessed by activity tolerance, such as symptoms during climbing stairs or walking distance limitations. Electrocardiogram remains essential for evaluating rhythm, ischemia, and hypertrophy in suspected cardiovascular disease. Heart murmur evaluation focuses on timing, intensity, and radiation, with echocardiography indicated for significant or pathological murmurs. Common pitfalls include missing systemic disease causing cardiac symptoms and overusing invasive tests without clear indication. Prevention relies on lifestyle modification, smoking cessation, blood pressure control, diabetes management, and lipid optimization. The NYHA functional classification ranges from Class 1 with no limitation to Class 4 with symptoms at rest. Class 1 has no limitation, Class 2 has mild limitation, Class 3 has marked limitation, and Class 4 has symptoms at rest. Cardiovascular disease management requires early detection, structured diagnostic approach, and individualized therapy based on stage and risk. Key takeaway is that cardiovascular disease is preventable and treatable when identified early through systematic evaluation and risk modification.